With social justice issues like human trafficking, sexual assault, and intimate partner violence in the media, one might ask, what is forensic nursing? Forensic nursing is the application of nursing globally when health and legal arrangements meet. It is one of the most recent but rapidly growing specialty areas in nursing. Forensic nursing is defined as the application of the nursing process to public or legal proceedings and the application of forensic healthcare in the scientific investigation of trauma and or death related to abuse, violence, criminal activity, liability, and accidents. Here we go. Virginia Lynch is the mother of forensic nursing. Virginia Lynch, the mother of forensic nursing, discovered her passion for the field when she visited a crime lab in the year 1982. According to her, evidence such as clothing, specimens, and records have so much importance but was often lost to the authorities when the victim is being treated in a healthcare facility. In a nutshell, a forensic nurse is a registered nurse who blends the holistic care of nursing to the body, mind, and spirit to include principles from the law, medicine, and science. Whereas a forensic patient is an individual who has a healthcare issue and intersects with the legal system. Do you want to know what is a forensic nurse? Forensic nurses are registered nurses who received specialized education and training to provide care to patients who experienced victimization or violence. They are the first point of contact between the victim of crime and the healthcare system. And from the bodies of victims of physical injury and violence, living or dead, they collect the physical evidence required for criminal investigations. They consult, cooperate, and communicate with law enforcement agencies and can be called on to testify in court as expert witnesses. Isn't that interesting? Here are the experts called as sexual assault nurse examiners, SANES, SANES. While sexual assault nurse examiners are probably the best known within the field, forensic nurse provides services in various fields where healthcare and the law intersect. This includes domestic violence, child and elderly abuse, human trafficking, death investigations, and human-made and natural disasters. Is there an international organization? Yes. International Association of Forensic Nurses, IAFN. The first convention of sexual assault nurses was held in the year 1992. In 1995, the American Nurses Association recognized forensic nursing as a specialty, after which the International Association of Forensic Nurses, IAFN, was established. IAFN, founded in the year 1992, the International Association of Forensic Nurses is the primary professional association for forensic nursing. As of 2019, included 4,400 members in 25 different countries. Here comes the most awaited answer to the question, what does a forensic nurse do? In an ideal situation, a forensic nurse will be the first healthcare professional to deal with a victim of violence or abuse. That includes sexual assault, domestic violence, child or elder abuse, human trafficking, assault, or homicide. He or she may also be called on to assess and collect evidences from the perpetrators of the crime. The type of evidence collected include specialized digital photographs of injuries, specimens such as blood, semen, skin, hair strands, and swabs for DNA analysis, clothing, bullets, and more. The nurse's psychosocial skills are critical in providing comfort, emotional support, and education to the victims and their families, especially during the interview, physical examination, and collection of evidences. Once the necessary evidence materials has been collected, the nurse either treats the injuries or refers the patient to the next level of care. The next curiosity: where do forensic nurses work? The forensic nurses work in healthcare and criminal justice systems, psychiatric institutions, coroners or medical examiners' offices, communities preparing and responding to natural disasters, and or correctional facilities. Most forensic nurses practice scenes in emergency departments and sexual assault centers in which they deal with adult and child victims of rape and sexual molestations. Forensic nurse work beside law enforcement, social workers, medical professionals, and public health organizations to develop an anti-violence response to human acts of violence. And forensic nurses may also be employed to work in organizations that deal with domestic violence and mistreatment of the elderly. What are the basic requirements of a forensic nurse? Working with the victims of trauma can be emotionally draining, and anyone who is preparing to become a forensic nurse, besides being compassionate, should be resilient and emotionally stable. Extra recommended qualities are needed for forensic nurses to qualify in this field. These include the ability to work and coordinate in a fast-paced environment. He or she must possess good communication skill, has the ability to give much attention to details, and has a good analysis and evaluation of an issue in order to form a judgment. What are the qualifications of a forensic nurse? The IAFN recommends a postgraduate certificate course to qualify as the same as the starting point for anyone interested in forensic nursing. This entails a minimum of 40 hours of theoretical coursework and 40 hours of clinical training in either SANE A or SANE P. Only SANE courses approved by the IAFN will qualify the nurse to take the certification exam of the Commission for Forensic Nursing Certification. A 40-hour didactic training includes survivor symptomology, documentation, history-taking skills, evidence collection, courtroom testimony, and forensic photography. Nurses can also obtain a master's degree in forensic nursing offered by various universities to qualify for advanced practice as a forensic nurse investigators. This is usually the requirement in order for aspirants to work as a legal nurse consultant, death investigator, or nurse coroner. Moreover, PhD degrees in forensic nursing and short courses are also open, such as a forensic nurse, death investigator, or intimate partner violence nurse examiner. Do you want to become a forensic nurse? Then check out this. The forensic nursing organizations. Number 1. International Association of Forensic Nurses, who develops the guidelines for the education of forensic nurses as well as continuing education opportunities. The Commission for Forensic Nursing Certification falls under its umbrella. They also publish the Journal of Forensic Nursing, and the membership benefits include publications, discounts on certification renewal, networking opportunities such as conferences. Here comes another organization, American Association of Legal Nurse Consultants. Thanks for watching. If you find this content informative, like this video, share with your friends and colleagues, comment your thoughts on forensic nursing. If you are yet to subscribe the channel, subscribe and click on the bell icon for more videos and updates.